Hey, Tim Reha here live at the Digital Health Summit in San Diego. We have another special guest from WellDoc. We have Chris Bergstrom, who's the Chief Strategy and Commercial Officer. Hi, Chris.
Hi, how are you doing, Tim?
Good. So we had lunch yesterday and really got an intimate story about how you guys got started. And a lot of people know me from working with the demo conference at Startup America. And so it's such a cool story to hear from you guys starting in 2005. Let's start there.
Yeah, if you think about it, when we started the company, terms like mobile health, digital health, those didn't exist. As a matter of fact, the iPhone didn't exist. There was no app store. When we weren't trying to create a mobile healthcare company, it's very interesting how the company and some of the founders and some of the leadership team came together from different points of view and different disciplines. If you think about our founder was actually a physician, an endocrinologist by training, and she was just trying to practice better medicine. She wasn't looking at it from a business point of view or trying to start a company. I, on the other hand, was coming from the medical device and diagnostic industry, working for some of the large and small players in that space, and was doing market research and traveling around the world talking to patients, doctors, nurses, dietitians, educators, distributors, payers, everyone in the ecosystem to understand, really what a good or a bad day was and how we could improve and have them have more good days and less bad days. And
we're talking about listening. Listening was
for me as a marketer, it was really the first time in my life where, and I really felt guilty as I realized I had never been truly listening. I'd always been trying to push a product. And finally, when I stopped doing that and listened to what was going on and tried to put myself in the shoes of other people, I realized, wow, there's huge unmet needs here. For example, you would find nurses that would spend 20% of their day chasing down data. As a business guy, I began to think, okay, well, at an $80,000 salary, we're talking almost $20,000 a year of wasted time if we could just grab that data and put it at their fingertips, let alone the benefits of being able to improve their health by using the information in an actionable way. So here I was coming at it from more of a business point of view of, how can we really address some unmet needs? How can we drive business models? And then our founder, Dr. Clough, was coming at it from how do I just help better manage my patients and support them through their life? What we both realized was we're going to need technology. And connectivity and wireless transmission and data analytics, and neither of us came from those backgrounds and disciplines. So we ended up finding other people like Dr. Iyer, who's our president and chief operating officer, and putting those disciplines of med device and medicine and technology together, we were actually able to create WellDoc.
Amazing. So very cool information there. Talk to me about the funding path. I know medical devices and things like that are different than data startups with the amount of cash you need to raise, but you took a different approach.
Yeah,
to the venture route.
Yeah, we were actually very fortunate. One of our earliest patients to go on our product happened to be a very wealthy and older non-technology savvy businessman, and his diabetes was very much out of control. And it quickly became in control when he used our product. And he said, oh my gosh, if this works for me, it's going to work for a lot of people. And he recognized the value that it could bring to society. And he wrote the first $1 million check to really give these physicians who are starting the company the courage to quit their day job and focus on this full time. We've really pursued an angel path ever since. And part of it was by necessity. It's different really in the last 18 months, but prior to that, there was not a recognition in the VC community as to what to do and how to fund mobile health or digital health. It was either people trying to fund technologies or people trying to fund medical device plays, and there was no real model in the funding community for something that was putting the two together.
Yeah, no deals to set valuation, no precedences, and it's just not in their vocabulary.
I noticed maybe 2 years ago they all began to say, we know we want to be in this space, but we're not really sure when and how. And then a year ago, they all said, holy cow, we're almost late to the party. We all need to have investments in this space. Now it's about trying to find the best one. So, I think if we started the company today, we may have gone down a different route. But when we look for investors, we really look for two things. One, obviously, can they bring money to the table? But more importantly, do they bring incremental value? And we've really found some neat people that have, taken companies from almost nothing to billion-dollar successes that can help teach and mentor us as we grow our company. People from life sciences, people from telecom, people from consumer products, and so really we found our investor base to be very helpful in teaching us how to grow the business.
Great. You made a big announcement today, and your company's changing rapidly into becoming a mass market player and getting this technology out. What's that path going to look like?
Yeah, I mean, my background has largely been doing multi-billion-dollar brands, and I really believe that if you want to make an impact on the world, you've got to have a product and a business model and a distribution play that's scalable to the mass market, and largely in a healthcare situation, most of the time that means you need to go through the physician providers. And so from a business standpoint, I thought it was very important that we had a product and a business model that worked very well within the healthcare professional office. From a clinical standpoint, it was really cool because it lined up to what we were trying to accomplish, that we very much believe at WellDoc that to accomplish better care, we have to have coordination between the physician's care plan and the patient's daily routine. And so in this particular case, the business model and the clinical needs aligned really well, and we're excited that today we announced the upcoming launch of the first mobile prescription therapy that's available for people with type 2 diabetes, and it's going to be reimbursed and adjudicated just like any other prescription product, and it's available for all doctors to prescribe.
That's really profound, because that is changing the universe around the world, of potentially changing the universe of this whole space.
You know, I think it is and it isn't. So it's taking a really unique product and helping people in ways that have never been helped before, to your point, but it's doing it within an existing paradigm and an existing business model. So doctors are used to writing prescriptions, pharmacies are used to adjudicating and dispensing prescription products, the FDA is used to regulating prescription products. So from that standpoint, we're really fitting into the normal cycle of doing business and practicing medicine.
So what is your outlook for the next 5 years?
You know, I think what we're going to see are a growing trend of products like we just announced today that truly fit into the mainstream of healthcare, that are appropriate and bring together both patients and doctors. And I think as we see those evolve and more people are using those, what's going to be amazing is then we lead into the analytics solution, which I see in 5 years, probably the value of the data far exceeds the actual products that are in use, because we'll begin to understand at a personalized level using that large of a database, oh, did you know that this type of patient with this behavioral characteristics on these 3 medications, actually if you added this 4th one, it doesn't work so well. But if you added this 5th one, it would work really well. And by there we can make the whole healthcare system more efficient and more effective. The other thing that I think is going to change dramatically is as we move towards a pay-for-performance model across all of healthcare, I think everyone's going to be held accountable for are they contributing to the solution or part of the problem, and we have to eliminate fraud, waste, and abuse. And to the extent that we have products where we actually know if people are using them or not,
it's a huge amount of work, billions of dollars.
It really is, and I mean the OIG gets involved. Medicare, has made a big deal out of it. They've really cracked down on it. I think the manufacturers of products like ours, and even like the pills and the other devices, are going to begin to be held accountable for, and no one will pay for their product if people aren't actually using it the way it's intended. So I see that as a trend that's coming over time as well.
Great. Well, hey, Chris is a valuable member of our family here at the Digital Health Summer Summit, and excited for your success, and I know you guys put a lot of work into it, so thanks so much, and congratulations.
Thank you, Tim. Appreciate it. Nice to be here.